Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I'm in a learning mood. What about you?
Yes, we talk about ourselves as being LearnSkin, right? And we are the LearnSkin podcast. We want to learn, we want to educate everybody, but we just realized we never really actually sat down and talked about education in dermatology. And we thought today we're going to have some friends come around the table and have a conversation. How about that?
I think that's a great idea. And I know when you're talking about education, we're talking about all levels, right? Medical school,
Yes.
residence, and even after we graduate, we continue to learn, hence, learn skin for life. So today we do have a special guest with us. She's heading up our intern program. This is Dr. Meg Gerstenblith, and she is a clinical associate in dermatology in the dermatology department at Johns Hopkins University. So she's no stranger to academic medicine and teaching, but man, I tell you, Hadar, she is darn good at it. So thanks for joining us, Meg.
Sure. Thanks for having me.
And I guess the first thing we should review for our listeners, who some of them may be dermatologists, some may not, is what is a scope that you think about, Meg, when you think about dermatological education? Because as Raja kind of alluded to in the introduction, we can talk about the general public, we can talk about people who are dermatologists, finished a residency, for example. There's other providers in our community. How do you like to look at it?
Sure. That's a great question. And I think in general, this reminds me of the old interview question that we all had to be prepared for when we went to medical school, which was, if you couldn't be a doctor, what would you be? And it was a no-brainer answer for me. I always said I would want to be a teacher. And I naturally felt that as doctors, we are all teachers. We're teaching for sure our patients first and foremost. And then if we do stay within an academic environment, even for those who are in private practice who often have dermatology residents or fellows rotating with them, we are always teaching as well. So for me, it does, as you mentioned, the general public. It extends from the general public, our patients at an individual level, and then certainly the trainees that we have with us, from sometimes even college students rotating with us. I've had high school students spend 2 weeks with me on a rotation, sort of a mini rotation in dermatology for senior projects that they do their last year in high school and all the way through residency. And it also is our own responsibility once we finish our training to really take ownership of our education to continue to learn ourselves. And I think that's also a hard job sometimes to do, especially if we're not connected to an academic environment. One thing I love about being part of an academic environment is the students always asking questions, because if I don't know the answer, it forces me to continue to read about that topic or look up the latest data on that topic.
When you're working with medical students, because I feel like working with medical students is a bit of an art. It's not like we get special training on how to work with medical students. In fact, I think it's the opposite. We don't get training on it. How have you evolved as a teacher when it comes to medical students? And then maybe we can go to residents from there. But I feel like medical students are so impressionable, and it really matters at that level on who's teaching them, because that almost is an indication for them that they love that field. The educator's almost synonymous with that field in many cases. And what do you think you've changed about the way you've approached medical student education, or maybe assumptions that you have about medical students?
That's a really interesting question. I think when I first started working and teaching with medical students, it was when I was a resident. And as you said, we have so many interactions when we are medical students ourselves with mentors and teachers that make positive and negative impressions on us. And so we sort of try to embody the best of what we see in our teachers and mentors and do those things for our students. I remember vividly, and this was one reason why I wanted to go into dermatology. When I was a medical student, it was the end of the day, a long clinic, and one of my teachers at the time, Dr. Francisco Pancho Tausk, called me into a room and said, you have to come see this patient. This is a really fascinating case. And I went in, and it was a patient with Gorlin syndrome. and the patient had multiple basal cell carcinomas really all over, and several that were inoperable. And patient had a history of medulloblastoma and had radiation, and he had multiple basal cell carcinomas within the radiation field. So I'm seeing this patient, and it became a group discussion as to how we could manage this patient. And this is probably the year 2001.
19 minutes ago.
Right, exactly. It feels like that. But this was back in 2001, I believe. Yep. So we didn't have any of our systemic hedgehog inhibitors, but we come out of the room and Dr. Tausk started pulling up all of this information for me about this drug called cyclopamine, which comes from the California lily plant, and how they discovered that when sheep went to higher pasture and ate this plant, the pregnant sheep had baby sheep that had a cycloptic eye, and they noticed that was a similar phenotype as what occurred in Drosophila that had hedgehog inhibition. So he was so passionate in explaining this to me and how cool this whole pathway was, and how suddenly what was happening in the developmental biology world was connecting to the cancer world, and how hopefully this cyclopamine or a similar product would actually become clinically available at some point in the future. And it was so exciting to me that I actually went and met with one of my developmental biology professors from first year of medical school, Dr. Philip Beachy, who was another important mentor in my life. And he proceeded to turn his computer around and give me a 20-minute presentation on everything that his lab was doing on hedgehog inhibitors. And I decided to do a year off in Phil Beachy's lab, basically because of Dr. Tausk grabbing me and saying, "You have to come see this patient." So that is in my mind as those moments that you had mentioned. You never know what moment in a medical student's life is going to really turn them onto a subject. And likewise, when you come across somebody who's not a great teacher and not interested in teaching, turn somebody off. So I think that I really loved when I had residents who were exciting and faculty who were really excited and happy to be doing what they're doing. And I think it's relatively easy for us in dermatology to be happy with what we're doing. We have, a great ability to make our patients better, and our patients have great satisfaction with a lot of our treatments. And so, we can easily be happy doctors. And I think if we can share that, and if we can share what really as individual doctors makes us happy, whether it's giving the backstory of a patient. I have a lot of patients whom I see their family members. So I will often see, a patient who had a melanoma, and then they want their family members to see me. And even though usually I mostly see patients who actually have had melanoma, I will see family members, especially first degree family members, because they are at increased risk for melanoma. And it becomes this sort of almost family medicine type style clinic where I know, everyone in the family. And I think that, when I am able to communicate to a medical student that I'm seeing this patient, but I also know, their brother or their sister or their kid, I think it's also gives them a different picture of kind of what we can do in dermatology as well, that it's not just, one patient going in the room and leave. We can actually establish these long-term relationships with patients. But I think ultimately it's sort of sharing what we are passionate about, and the students can easily see, who's really, truly, genuinely interested in what they're doing and who's not. And so I think really finding what you really like and then sharing that with students is the best way to bring them in and get them interested. In terms of how I've evolved, I think just naturally, I sort of went from feeling more like I could remember what it was like to be in their shoes to now being, so many years removed that it's harder to see that, but also that it's also important to share what life is like on the other side of training. And I think sometimes medical students see a lot of what happens in the hospital setting, and they don't really get that sense of when you're done your training and you don't have a practice, that you're fully in the hospital, here's what life is like. And I think that that's valuable to them. And I also know that a lot of medical students and residents do talk to me a lot about the work-life balance and sort of how that evolves. And that's a conversation that for sure has evolved, as I've gone on and had children of my own. And I think that's something that people also feel comfortable talking to me about, because I do see patients clinically, on a part-time basis. So I think students and residents do seek out, men and women residents and medical students do seek out that conversation from me too. So I think that's evolved in certain ways too, is more discussing the work-life balance.
Thank you, Meg. Wow, so much to unpack here. One thing that comes to mind, among others, is as you were talking, I was thinking to myself, we're talking about this as if, in my mind at least, teaching is an academic institution kind of task. But more and more in life, as you go out to practice in the community, doctors, dermatologists are expected to be teachers because we all have mid level practitioners. And if we are lucky enough to be integrative practitioners, we interact with other people in our dermatological sphere. And so we have to be teachers and use all this kind of excitement you mentioned in order to inspire people to move to the next level of learning and kind of join us on this journey of learning together. So basically, kind of carry an entire practice on your shoulders, if you will, just by virtue of being a good leader. One of them is being a good teacher. And so, but I really want to touch on that principle you mentioned about staying happy, which really resonated well for me, because one of the things I try to do is tell my trainees at any level is to not become cynical. It is so easy. One of the things I usually tell medical students, first year medical students, is, look, especially now we're recording this around summertime. So it's the transition time. Everything is new, right? In academic medicine, you have new medical students, new residents. And I try to tell them, you see that excitement you have today. You just saw for the first time a patient with, I don't know, psoriasis. Just keep that enthusiasm. Don't become cynical. Our system of education is really built in a way to beat that excitement right out of you and really kind of get you into the nitty gritty of the daily practice, that you forget what kind of privilege we have as practitioners to become part of these patients' lives and affect them. So it really resonated with me, this idea of being happy and enthusiastic about what you're doing, and that will infect everybody as a way of training and inspiring everybody around us.
For sure. And I think that that is something that actually I've become even more excited about what I do as time goes on. And so I think that while in the early days of mentoring residents and medical students, there was more of an affiliation with them and sort of a, hey, yeah, we're in the trenches together. But as I get more removed, it's more about sharing the joy of what's on the other side of training.
Yeah, when it comes to mentorship, I do have to say one of the things is really understanding the student perspective too. I think where sometimes we fall short when we get into medicine is we forget what it was like as being a resident or a student. And I think it's easy to just think everything should come easily, but all of us had a process. And what I really appreciate about you, Meg, is that I think you understand that, and you understand that it requires a bit more time and patience. So along those lines, I do have a question for you. This is more generally, even including residents. When it comes to integrative medicine, I mean, here obviously in LearnSkin, we are so committed to an evidence-based approach to integrative medicine. When it comes to integrative medicine, where do you think residencies could grow? I don't want to say fall short, because I think they're doing a very fine job in the sense of they have so many guidelines and so many things they have to follow in terms of dotting the I's and crossing the T's. But how do you think that medical education could expand into integrative medicine that would make sense in the medical schools and especially in dermatology residencies? What would you do if you were, say, the program director? How would you change things?
Sure. No, that's a great question. And I agree with you. I think, there are so many boxes that these program directors have to check and that the residents have to spend time learning so much within dermatology. But I do agree that I think that learning integrative medicine and integrative dermatology is so important. We know our patients want to learn about it. We know we want to learn about it. And so one of the ideas that we have been discussing is putting together a summary of recent journal articles that touch on integrative dermatology topics. And if we can digest a lot of material down into very easy to read and to keep up with chunks of information, we can certainly give that to derm residents for something that they can read quickly and easily and also feel caught up with the literature. I think that is something, what we're working on that could be very accessible to dermatologists at all stages of training and also dermatology providers within the field. So I think that is something we could do for residents. I agree with you. I'm hesitant to introduce something that would be one more requirement, but I'd rather follow their interest and give them more conferences they can attend, more access to what we offer at LearnSkin, in terms of being able to introduce them to the world of integrated dermatology.
Yeah, Meg, on that note, I mean, don't you think though, even though, I mean, I'm the one that posed the fact that there's so many boxes they have to check, but don't we kind of have an obligation to get them learning about integrative medicine early? Because if they don't, it's almost like what you learn in residency is where you develop the most openness in your mind. And of course, we do it as we go along, but I feel like if you don't introduce it then, it becomes a little bit more difficult to introduce it to the general populace of residents, and then you kind of depend on their interest. But I feel like so many patients ask about this. The last thing you'd want, for example, is someone to say there's no evidence for nutrition in dermatology, which is literally what some people told me. And I'm like, well, I mean, I hope no one says that anymore, at any level.
Right, exactly. When I was a resident, it was just when a lot of the studies on milk and dairy were coming out with acne. And the party line before that was that diet, does not impact acne. That was what we were definitely taught. No, I agree with you. I think that at some point we do need to figure out how we can reach residents more formally. And I think that is something that we can think about. I think LearnSkin has great resources in order to sort of leverage the education that we can provide to residents. I think the question would be, how do we do it in a way that makes it fun for them and captivates their interest rather than making it one more box that they need to check? But again, like you said, I think, appealing to the fact that patients are asking about this, they want to hear about it. And also, I talk to my residents a lot about nicotinamide in particular with skin cancer, and they're very open to learning about integrative health as it pertains to dermatology. So I think we will have a captive audience, and I think we have to figure out the best way to introduce the information for them.
One important aspect about this, especially for trainees and early trainees, as you mentioned, Raja, is that I think people come in wanting to change the field, change the world, change what is happening around them for the better. And, a lot of big topics in dermatology are really plowed fields, if you will. Something like psoriasis, for example. Again, there's always something to learn and we can always improve. But I mean, gosh, we've made so much advancement. And so to me, integrative medicine within dermatology really represent a whole wide field for inspiration for the young generation coming up through the ranks to say, hey, you want to ask important questions. You want to ask questions about how integrative medicine interacts with the skin. What can you learn about nutrition, about lifestyle changes, about anything and how it affects the skin, the gut microbiome, the mind. So all these areas are really ready for studying. And if we wanted to inspire the next generation, just educating them about the fact that there's a lot of gaps there. There's a lot of questions to be asked. And who knows, maybe you can even change the field. So to me, that's almost an advantage we have here when it comes to educating the next generation. One of the best results in my mind in PubMed when I search for something is nothing. Zero. I was like, okay, that's a question that somebody needs to ask.
Hadar, it could be that you misspelled stuff, man.
That's also a common error. Yeah, I always have to check. But I feel more and more in integrative dermatology, when we search in PubMed, it's usually like, oh, no results found.
Stop spelling color with that you Canadian British person.
Exactly. Yeah. That's me, the Canadian British person. Absolutely. From Israel.
I think that also now, since COVID and everybody is so familiar with Zoom and online courses, that we also could consider reaching more derm residents through something online as well. And I do agree with what you said, Hadar, that when we are entering sort of our training years, we are the most open to learning new things and to wanting to kind of revolutionize the field. And we should take advantage of that. I agree with that.
Well, Mega, the other thing that I wanted to bring up, because just to kind of move away from this topic of education amongst the early trainees, what do you think is the best way that you found to engage us that are now past the training phase and into this phase where we're trying to learn on our own? Like, what do you find personally to be the most engaging ways for you to learn? I'd love to learn a little bit more about maybe your style of learning.
That's a good question. I miss being able to attend as many conferences as I used to before COVID.
Oh my gosh, yes, I totally agree.
And before kids, because I do feel like the most impactful we're going to the late breaking sessions for the new, research that's being presented, as well as really the subspecialty meetings. So for me, the Society for Melanoma Research was really beneficial because it was all the melanoma researchers in one place. And that's actually one of the first places where I met the collaborators who I do some international melanoma research with through the Intermel Consortium. We were at the Society for Melanoma Research meeting in Philadelphia, and we sat down and met, and we subsequently, after that, wrote a grant together. So I do miss that. That's for me one of the most exciting times, and it was going to from poster session to poster session, and basically asking the people standing at the posters, like, tell me about your project, like, why did you look at this, why did you look at that? Because the one-on-one learning, I think, or at least small group learning, is for me the most high yield. So I think that that's challenging. It's harder to find, but I think being connected to academic centers, I do still have the ability to go to grand rounds conferences, which in dermatology are really fun because we're seeing the patients live and then having, a discussion. So that's another great way that people can stay engaged. And then I think there is a lot of content online that we have to curate and go through to figure out what will give us the most information in the shortest period of time. But again, I think that's where, LearnSkin has a great platform within the integrative dermatology world to present a lot of information in very different formats that are, either quick reads or longer courses. But it is hard. There's sort of like a lot of information out there online, and it can be hard to actually figure out, how to get through it. Certainly keeping up with the journals, looking through the table of contents and looking at, the articles that feel most relevant to what I study and reading them, and, trying to also I still do reviews for several journals, and I like doing that. And I feel that helps me kind of keep up with what is coming out and what's new. So I think those are all ways we can continue learning once we're finished. But it is not easy to wade through how much is out there and available.
Meg, I think one thing that I really do miss, especially with these conferences, that there's the intangible. It's
Yeah.
like you see the lecture, and you can do that online too. You can see the lecture, which we think is exceptionally powerful. And so, I mean, I know we include a lot of online programs, and that's for that very reason, just for convenience. But at least being able to attend a conference a couple times a year, being able to look right, look left, seeing people that you would have never met, and then doing that in person, and then having like the ability to gather together. I feel like there's such power in that
Yeah.
you just can't describe. So I think having both available, I feel like is important. But I want to echo what you're saying about in-person meetings. I think that's a real key thing that I also miss.
Oh yeah, I still remember one very particular small presentation from a group that was looking at one of the or two of the very large cohort studies out of Boston, and they presented this finding, that one finding among many, that they saw this inverse relationship with people who had a higher BMI had a lower risk of basal cell carcinoma. And at the time, I was at the NIH looking at the US radiation technologist cohort study, and they are one of few studies that actually do collect data on basal cell carcinoma and squamous cell carcinoma. Because, for example, our surveillance epidemiology and end results database, which is through the National Cancer Institute, does not collect basal cell and squamous cell carcinoma data because it's hard. There's just so many of them. It's hard to collect them all. So there are really only, there are not a lot of databases that actually count those numbers. And so we had a lot of information, and that we had actually noted that our patients as well in this cohort, those with a higher BMI, had a reduced risk of basal cell carcinoma. And we were able to, adjust as much as we possibly could in this cohort study for sun exposure and, UV radiation exposure. And so I remember going up afterwards and speaking to one of the researchers who was presenting and said, "Hey, can we talk for a minute about the finding on the BMI and basal cell carcinoma? Because we have another cohort that we see this in, and we didn't know if we should believe it or if it's, real." And he kind of discussed, what they saw in further detail. And we went and then we published our study. So it is exactly what you said. It's those intangibles of, yes, you can look at somebody's slides and even hear their presentation, but to be able to go up to people and have that conversation is something that is invaluable.
And I agree. And I think this in person kind of meetings that you do, be it at the lecture or the interaction by the poster or just sitting around the table having lunch together with people from all over discussing patients that you saw or this treatment that just came out. I think all these bring together such a powerful impact on clinicians, more than any article that you read, more than any class that you can take online. To me, it's all kind of coined in a saying that is attributed to the founding chair of dermatology here in Miami, Harvey Blank. He apparently, I don't know him personally, but apparently used to say, there's nothing more dangerous than a dermatologist coming back from a meeting, because you're loaded with idea. You're just exploding on the first patient you see with all this new stuff that you learn that, sometimes can be dangerous. But in general, that kind of speaks to how powerful that experience can be. And if you do it once a year, let alone if you do it multiple times a year. So I think it's a great way to kind of end this educational segment to talk about the idea of go out there, seek learning. Sure, you can do it online, but know that you're part of a community and you can learn so much more in person. And if you are one of those people who are curious about integrative dermatology and want to learn in person, then for sure, the Integrative Dermatology Symposium is the place for you. But if not, you can just check out LearnSkin and, of course, other resources online. So, Meg, thank you so much for joining us. I can't believe time flies by, but we said we're going to just sit around the table and talk among friends, and boom, time flew by. So thank you for joining us for this discussion.
No kidding.
Sure. Thank you for having me. It's great to speak with both of you tonight.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf, or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. Use our discount code POD25 at checkout for 25% off.